Thank you for tuning in to the first in a series of videos about issues related to the COVID-19 worldwide pandemic, also known as coronavirus. Today, I have Dr. Paul Reiss joining me to share with us answers to some of the questions I've heard Vermonters asking over this last week. Dr. Reiss is a family medicine physician at Evergreen Family Health here in Vermont. We'll be talking about COVID-19, preventative measures you can take, the symptoms of COVID-19, and what to do if you have it, and other medical steps going forward. Thank you for joining me today, Dr. Reiss.
Good to be here.
Let's talk about what we mean when we say flatten the curve.
The whole term flatten the curve really tries to address the issue of preventing a huge spike in the number of cases and the number of very sick people, which would totally overwhelm our healthcare system, our ability to test and our ability to treat those who are positive. Or those who are very sick. Flattening the curve actually doesn't necessarily cause less cases, but spreads them out over time so that you have a chance to manage them in a way, well, for instance, like we handle the seasonal flu every year. It just sort of happens throughout a flu season. It's not like everyone gets the flu in December, and then you have to treat it all at once. So flattening the curve is a way to be able to manage it better. Now, we should hopefully be able to do both, reduce the number of cases and to have them not be such an impact on our healthcare system. The only way we can do that for this new virus, which people don't have immunity for, is to reduce the spread of it and limit the new cases that are happening now.
Maybe for those most severe cases, there's a limited supply of medical opportunity to treat them with ventilators in the hospital and so forth. And if someone's got to be on one for a few days to get through it, and we only have a limited number of ventilators, then if we have a spike in severe cases, that's when we get maybe an increase in fatalities. So we all maybe need to do our part to try to really reduce that, is what I think the main measure of flatten the curve. Is that accurate?
That's right. And as a matter of fact, a lot of patients need to be on a ventilator for more than a few days, a week or two sometimes, because we don't have treatments that are particularly useful for this virus and the inflammation that it causes in the lungs. So it takes quite a while for your body to recognize it and create antibodies against it, and then to fight it off. That's the process that has to happen for you to get better, because we don't have antibacterials or antibiotics to treat this. It's a virus, and we have not developed an antiviral for this particular type of virus at this point.
There's a lot of information circulating in the media or social media in particular about COVID-19, how to treat it, things people are being suggested to do for self-medication or prevention, and it seems like a lot of them may actually be quite dangerous and maybe not backed up with any science. So how does someone know where to get reliable information about what some of the known ways to treat COVID-19 might be, or are there any medications in trial, and what are some of the things you've heard that have been suggested for people to do?
Well, the first thing is people with mild symptoms, obviously, you're treating it like a cold. You have to isolate and prevent others from getting it as best you can. But we really don't recommend taking a lot of things for the common cold. They might help with symptoms, but they don't treat the actual cause, which is the virus. So your best source of advice, if you need treatment, you're sick enough that you should be talking with your doctor or a doctor, some kind of a professional with some scientific background that is trained or well educated in this virus and its infections. And at that point, they can make recommendations to you. There's some discussion of medications that hold some promise for the future. These are not proven. They're available for other conditions. And it can be risky and dangerous to try these treatments on your own, or because a friend loaned you the pills, or because someone on the internet thought it was a good idea. You really should be talking with a professional on this issue rather than trying your own home remedies. And if you're sick enough, you really should be in medical care.
From various reports, there's varying degrees of severity of COVID-19, and everybody seems to react differently in terms of how their body reacts to this virus. What should someone do if they've got what would be defined as minor symptoms? Maybe you can help describe that. Moderate symptoms and or more severe symptoms. You indicated, obviously, if you're getting more severe, contact your doctor. Should they contact doctors earlier in that process with minor or moderate symptoms as well?
That's a good and a very important question. Those folks who should contact their doctor early are, number one, folks who have been exposed to a known positive COVID-19 patient. So exposure is one of those things. Number two, folks with chronic medical problems, especially heart and lung disease, and those who are immunocompromised, meaning they're actually on drugs or being treated for a cancer, for example, that they're on treatment that actually weakens their immune system. Their white count is low, or they're on medications that suppress their immune system for rheumatoid arthritis, for example, or other immune conditions like psoriasis or lupus, for example. Those folks are immune compromised, and mild symptoms should be caught early so that they can be treated and isolated, et cetera. So again, those folks who are at risk from those conditions, those folks who have contacts, and of course, healthcare workers. You really need to know if you're positive, if you're a healthcare worker. Those people should be contacting their primary care physician, and most of those folks should be tested. The majority of people with mild symptoms should self-isolate, and unfortunately, right now, we probably don't have the capacity to test every one of them. There's plenty of asymptomatic people who probably have this virus, but we don't have the capacity to pick them out. If we started testing everybody, we would back up the whole system. Ideally, we would test everybody and figure out who's carrying this around. And hopefully, if we can flatten the curve some, we can get around to doing that. So it's a difficult balance. Mild symptoms, contact your doctor. Your doctor will help you decide whether you should be tested. Pretty much anybody with symptoms should be self-isolating.
What would some of those key symptoms, mild symptoms, be that people should be watching out for?
Almost all patients have cough and or fever. Again, there's plenty of people without any symptoms, but the folks who are really focusing is cough and or fever. The CDC website and other people, report shortness of breath. Now, shortness of breath is important, but most people don't have it. Shortness of breath is really important for distinguishing who's sicker. If you have a mild illness, you're not going to be short of breath. Your lungs can handle it. But if you're short of breath, getting winded going up and down stairs, or just sitting there, you're breathing faster than usual, that's an indication that it's a lower respiratory tract problem. And you should be contacting your healthcare provider. So cough, fever, and then, of course, shortness of breath is very important to report to your physician. But people can have GI symptoms, nausea, vomiting, diarrhea. People can have certainly runny, stuffy nose. Sneezing is not one of the things. That's allergies or common cold type stuff. It doesn't tend to be this. Sore throat tends to be part of this. But those kind of respiratory symptoms, including headache, all over, what we call myalgias, and then fatigue. So those follow with cough and fever.
Dr. Reiss, this has been very helpful. I really appreciate your taking the time out of your, I'm sure, incredibly busy schedule. I imagine you're going to a lot of telemedicine work at this point. I know the state has tried to help with making that a little bit more feasible, both regulatory-wise and compensation-wise. I hope very few of your patients fall ill with this. We appreciate your time. I'm wondering, are there any final remarks you want to add?
The important thing is to self-isolate and to socially isolate at this point. Keep your distance, wash your hands, wear a mask if you're sick, and so you won't spread it around. And really pay attention to the hygiene measures that will try to reduce this spread. Just this kind of educational thing. Hopefully, if we get the right information out to folks, we can slow this thing down.
Appreciate it. Speaking about information, if anybody who's watching this wants more information about COVID-19, you can visit the Department of Health website at healthvermont.gov. That's healthvermont.gov. You can also visit my website, zuckerman4vt.com. We have an immediate COVID page that comes up first with information about the illness, about employees, employer situation, and getting unemployment. We really appreciate your time, Dr. Reiss. I'm Lieutenant Governor David Zuckerman. This was many conversations I'll be having with experts about coronavirus and how we can all flatten the curve and take care of our communities and make it through these challenging times. Thank you, Dr. Reiss. Appreciate it. And thank you all for tuning in.